Hello, I'm Doug Greenwald with Convergint Technologies, and joining me is Robert van den Heuvel. And welcome to our discussion on how to streamline workplace vaccination verification. Robert and I are part of the digital transformation team here at Convergint, where I specialize in identity management solutions, and Robert focuses on market intelligence, so we can stay up to date on how our solutions need to be developed in a rapidly evolving world. During our time together, Robert and I are going to be walking through a solution we've developed in partnership with one of our identity management providers to deliver a COVID vaccination verification platform to support ongoing back-to-work initiatives for healthy workplaces. Robert will be providing a market overview today as to how we are addressing these new challenges, and I will be presenting on the solution we've developed to automate this process entirely for your organization. Robert, I'll turn things over to you to start.
Thank you very much, Doug. So yeah, I will be talking from a market intelligence perspective. I will give you a market overview, what we see, one of the larger companies, what they are doing and what the market is going up to. Then we are looking at some regulatory updates as well. So as you can see in this market overview, the United States will actually be starting a booster program on September 20th. Research has shown that vaccines, they wear out in time after 5 and 8 months. And so it's for a lot of Americans time to get a booster. The vaccination rates are steadily going up, and nearly 210 million Americans have now received at least one dose, and 175 million of those have been fully vaccinated. If we're looking at the COVID cases, there's a 3% increase in daily cases with a current 7-day average of 142,000 active new cases. So that's really gone up. One of the scary things is actually the rise in children that are being hospitalized and are in the ICU because of COVID. And we're looking at over 1,900 cases at this moment. The travel restrictions that have been in place between the borders of Canada and Mexico have actually been extended. First it was in June and July, then it became August, and now it's all the way up to September 21st when we're looking to perhaps open the borders again for the neighboring countries. Another big market event that has happened was actually that there were 1,500 healthcare systems across the United States that now are actually mandating their employees, but also their contractors and people that are coming onto the vicinities that they have to be completely vaccinated as well. In our next slide, we're going to look at the industry action. So what are the major industries doing? And as you can see, just from a quick overview, they're sort of all over the place. Like if you look at, for example, the large tech companies, they've really been divided in how to address these type of issues. So some are encouraging people to get vaccinated and their employees to get vaccinated, and some are even offering bonuses of up to $100, where others are not mandating vaccines and have been actually pretty quiet about, what they think is their standpoint of mandating vaccines or not. But there was one big thing that stood out, that was actually the return to the big campuses. Most tech companies are really mandating that you are fully vaccinated in order to return to those campuses. If we look at the financial institutions, they are really requiring employees to disclose their vaccination status, but that they're not actually mandating it, but that they are expecting employees to do regular testing and obviously come in with negative tests in order before they can come return to the office. And one other one that really stood out for me was for us as Convergint employees, is that for our customers, a lot of them are actually requiring all of our staff, when we come as technicians onto sites, that we are fully vaccinated, and that we can show that we are fully vaccinated as well. So just a negative COVID test is not enough for us to actually come and do our work at their vicinities. We will now have a look at the regulatory updates. OSHA updated their guidance on mitigating and preventing the spread of COVID-19 in the workplace on August 13th. Before, they weren't as strong and giving about strong statements on employee vaccination. So this has really been the strongest to date. And they're actually recommending fully vaccinated people to actually wear masks in all public indoor settings right now. They're also really encouraging employers to facilitate employee vaccination. So whether that's at work or away from work, and in that case, actually offering paid time off, so PTO, to get vaccinated. If employees are suffering from any side effects, they should even consider personal time off or paid time off to recover from any of the side effects as part of this facilitation for employees to get vaccinated. Organizations with 500 employees or less are eligible for tax credits until September 30th, and also when they're considering personal time off. And when we're also looking at the ADA and the EEOC, vaccinations must be kept apart from a worker's personal file. Private employees are required to keep these separate files for at least 1 year after creation, or at least 1 year after termination. So that means that if you're in HR right now and you're trying to store that data, it must be kept in a separate file and on separate servers. So therefore, we're looking at these type of solutions that Doug will talk about momentarily to help you with that. Based on all of the research that we've done, and based on what we've seen happening in the market, we really thought this was the right time to bring a new solution where information where it needs to be separate from existing HR system, while also providing a path to enabling access to facilities through access control, was really critical. And therefore, I would like now to turn it over to Doug, who will provide the solution overview.
Robert, thank you for that data. Really helps us understand just how much of a collaborative effort this is right now to respond to these quickly changing expectations of employees, contractors, and visitors as they return to the workplace across many organizations. As part of my role, we needed to identify a solution that solves for 3 critical things. The first, of course, automating this data collection process. Secondly, being able to generate real-time notifications, reporting, and dashboards based on this data. And lastly, enabling outcomes based on the data received. So let's dig into each one of these 3 things on the screen right now. First, automating the process of collecting vaccination cards is critical. And depending on your circumstances, having as little as 1,000 employees, or even just having to require your contractors to show proof of vaccination before coming to the site should put automation at the top of your list. What are your alternatives? Well, you could visually check vaccination cards when someone comes in every day, but this would be on par with the expense of using handheld thermometers to check people as they came in, as we saw during the start of the pandemic. Obviously, a significant daily cost. Additionally, if you were planning to photocopy or have employees send an email to HR to verify and store vaccination cards in employee files, you could be in violation of the ADA and EEOC guidance around vaccination status being kept apart from the workers' personnel files. Having a separate system to maintain this information is a key component of our solution. Now, when it comes to attestations, there are challenges around people falsifying vaccination cards, and even some jurisdictions not even handing them out. So you are further burdened by having to protect yourself as an employer from fabricated documentation. For the employee or contractor, before they upload, you can have a disclaimer that addresses both U.S. code and some states' legislation that has been enacted around fraudulently creating or claiming to have been vaccinated. If they attest and still upload a document, or say they don't have it but were vaccinated, you've taken appropriate steps to protect yourself in the event that this is found to be false. Once this attestation is complete, area managers or security can be provided notifications around those that are clear to return to the office. But this may still pose a manual challenge for having to verify proof of vaccination tied to building access control. This obviously paves the way for another reason for automating access control privileges. Once badge access for an employee has been deemed cleared to return, their badge can be re-enabled entirely. So you can require as often as just a single validation or daily health questionnaire verification each day so that somebody's badge can be turned on or off. Here's an example. An employee's badges are all turned off before you implement this system. You send out an email notifying everybody that they need to upload proof of vaccination. Once they complete this, they can either have their badge turned back on in perpetuity, or they are now moved into a status where they will receive daily health attestation questionnaires before coming to the office. Once answered, if they pass, badge is turned on for 18 hours, with the employee moving to a badge turned off status each day following their shift. The point being is badge access can be controlled as your organization sees fit, and be customized to fit different locations based on that site function, local infection rates, and operational needs in a completely automated fashion. Now we'll move on to the next slide. Beyond these core capabilities, you also can send notifications to other stakeholders, improve and automate the contact tracing process, and meet critical COVID compliance reporting based on your jurisdiction's requirements. Now, on the attestation side in this next slide, these are completely private and confidential in compliance with what we have described surrounding EEOC, ADA, OSHA requirements, with the data being encrypted both at rest and in transit. Now let's look at a sample of the employee journey within this solution. In email, it's sent out to the employees within the identity database. The employee can then fill out the form, upload an image, and complete this from a mobile or web-based portal, whichever is convenient for them. You can also see the check mark at the bottom that requires that they attest under penalty of perjury that these documents are true and accurate. From there, the system will perform automated operations based on that data, including the option for one-time access control enablement or activating the profile for those daily health screenings as I described previously. And at any point, if someone reports that they don't feel well or they fail the attestation, the portal can deactivate their badge, notify appropriate team members for follow-up with that employee's boss or the contractor to determine next steps. Now, from the employee side, they're going to receive either an improved or not approved status that can be visually verified at the site as well if desired. Now, I know what you're thinking. All right, I'm going to implement this new platform, but what happens if this goes away? Well, beyond vaccination use cases that we've covered here today, the platform also gives you access to a robust ecosystem of integrations, workflows, and capabilities that are available within a mature physical identity and access management solution. This could be enabling logical access for employees so they can't access company systems until they've completed this status update. It could be creating the entire hire-retire process for provisioning all physical and logical systems by using this single source of truth. And lastly, but certainly not least, the opportunity to build a contractor-specific portal or add visitor management, all from the same platform, which allows you to consolidate your systems, spend less time training, and drive automation where simplicity and data-driven results in the event COVID is no longer the main use case can still add tremendous value to your organization. Now, if anything we've discussed today sounds like that it's in line with your organization and what you're looking to do, reach out to myself, Robert, or your local Convergint office, and we can specifically create a customized deployment to meet your needs. Thank you for taking the time. On behalf of Robert and myself, be well, and we look forward to working with you in the near future.